I'm Reverend Sister Joyce Chika Ezeugo. I'm an obstetrician and gynecologist. So today we are trying to answer most of the questions raised by some of the people that viewed our previous discussion or interview. I noticed that majority of the questions are mainly on infertility, people that are unable to conceive, then fibroid, most of the infections that affect commonly women of reproductive age. Then for men, most things they ask have to do with the prostate diseases and also some common chronic non-communicable diseases like hypertension, diabetes. I didn't open any Facebook or whatever account where people pay for consultation or people send in to book for appointment. No. This program is purely and wholly managed by FIDES. I didn't ask anybody to open any consultation and appointment in my name, please. We want us to start first from the development, what we call developmental milestone. Some children are born, they have what we call ambiguous genitalia. That is, you cannot, confidently say that this is a male gender organ or a female gender organ. But if you are quick to say, hey, it's a male child, because that part of the female genital area is larger than normal, you say it's a male child. At the end, you cause confusion in that child's life. Somebody you are raising as a male will now start developing breasts later in life because genetically the child is a male. It's a female, not a male. Don't rush to give that sex of rearing. Make sure that people that know better, investigate further and give that child sex of rearing so that it will not cause permanent damage on that child. Some of them might not even live long to handle such confusion in their life. Remember, if you deliver a male child, definitely when they urinate, you discover that urine is supposed to come out from the center of that penis. But there are some children, when you deliver them, when the urine is coming out, you discover that it's coming out as if it's coming out from under. This is what we call hypospadia. It's not normal. What do you do for a child like this? Please don't circumcise this child. This child needs to be seen by a pediatric surgeon. So that instead of, when you circumcise the child, you remove those skin tissue that you will have used to repair the damage. So most often, some of them have already had their circumcision done. By the time they are bringing the child, it will now become a difficult task. And when you're asking questions, don't ask the people that are more ignorant than you. Ask people that you know that may have the answer, so that they will give you the correct answer. Ideally, when a girl child between the age of 8 to 12, a lot of things will start developing. That is usually after from 8 years to 12 years. Some of them will start developing breast. Some will start having small hair. By that 13 or even 12, some of them will now see their first menses. That their first menses is called what? Menarche. They say this child has attained menarche. Now, if this child that's supposed to have started menstruating, by 14 years, if a child has developed breast, has developed hair in the armpit, the pubic hair, or around the pubis, and by 14 years of age, she have not started menstruating, it's not said to be delayed. There is no problem. Still give her another 2 years. If she did not menstruate, then you can take her to appropriate professionals to find out why. In some cases, it might be constitutional, that is genetic. There are some family that has delay in onset of their menarche, that is the first menses. Sometimes when such a thing happens, they will say, oh, my first daughter also had a similar problem. In such a situation, it's not an issue. In some cases, there might be one or two things that contributed to that. That's why it's always good to try to find out what is the cause, and then always make sure you meet the appropriate authority, the professionals in the field. But if this child doesn't have any breast, by 14 years, no breast, no pubic hair, and this time have not started menses, definitely that child needs to be what? Investigated. But one bad thing mothers do that is not good, we have to desist from it and be careful, is you don't compare one child to the other. Not when you go to your gossip group, whatever they say there, you come and bring, try to use it to rear your own child. No, you don't have the same genetic makeup with that your friend that you're trying to compare your child with. Also, with regards to male child, between the age of 9 years to 14 years, a male child will start, coming into puberty. Some of them, you see them, their voice will start deepening. When they talk, the voice got deepened. Their penis get bigger. Even the back, the testes, it get bigger as well. Then some of them also will start developing the hair around the mustache, around their upper lips, showing you that we are about to become a man. So these are some of the changes, and that you're supposed to watch it and make sure that it happens when it should. So this has to do with the development, because why we decided to dwell a little on this is there are some questions that are bothered on how can my male child suddenly start developing breast at a tender age. But like one of the cases, finally we discovered that the child wasn't a male child, the child was a female, genetically female. And if you have met the appropriate authority, in some cases there are sometimes we have those confusions, but the professional we look for which sense of reality will you be able to make this child to grow with and be happy later in life. They can help you. There are some cases, the gonad, what we call gonad in female, the ovaries are the gonad. In male is the testes. So there are some cases that you need to do surgery and remove one and use hormone and support that person so that the sense of rearing and the development of that child will be the same. But this is beyond our discussion. But know that in some cases you will deliver a child, there will be some confusion. You really need the specialist in that area to help you give appropriate sense of rearing.